Cerulean Simulations is a virtual environment where medical students, emergency physicians, and EMS professionals can work through an infinite number of medical cases and scenarios in order to improve patient assessment, diagnosis, and patient care. So why is this needed? In 2018, the University of Minnesota Medical School Department of Emergency Medicine found that the second-year medical students greatly struggled in the areas of patient assessment and diagnosis during their annual competency and skill testing known as milestones. Simply put, you cannot help a patient if you do not know what is wrong with them. Simulation education in medicine has been proven to promote transfer of knowledge while promoting higher-order thinking skills such as synthesis and evaluation. However, simulation education can be both a resource and labor-intensive endeavor requiring equipment, space, personnel, and occasionally standardized patients. Using virtual reality technology, Cerulean simulations will simulate and recreate a virtual emergency department. This could even be an existing one. Cerulean simulations will also simulate patients in the emergency department along with an infinite number of medical and trauma cases ranging from simple bone breaks to more complex and more difficult scenarios such as a flailed pneumothorax. In this virtual world, the student will interact with these virtual patients and practice putting their assessment and diagnosis skills to the test, receiving a score and immediate feedback on their performance based on actual medical school metrics. The simulations can be made as simple or as complex as the student wants and can be made more difficult by adding a timer or even changing the language that the patient speaks. The first of the three design use qualities emphasized by Cerulean simulations is immersion. Using virtual reality, the student will find themselves immersed in a recreated virtual emergency department along with virtual patients. This, coupled with realistic sounds of the emergency department and interactive patients, the student will be able to feel as if they are truly in an emergency department setting, interacting with patients. The second design quality emphasized by Cerulean simulations is relevance and meaning. Cerulean simulations exist because of the need for better patient assessment and diagnosis among University of Minnesota Medical School students. These two things will have a direct impact on the quality of patient care, and using virtual reality, the students can practice honing these skills while practicing in a recreated virtual environment. The third design quality that is emphasized is autonomy. In all of these scenarios, the student plays an active role in which they are the leader. The student will have to succeed or fail based on the choices they make and will work to improve in each scenario. Other design qualities include pliability, variability, and anticipation. Integration of Cerulean simulations will begin with the University of Minnesota Medical School. The focus will be on medical students, specifically those that wish to pursue emergency medicine as a career. Cerulean simulations can ultimately be expanded to other areas of medicine and can also be used to help practicing medical doctors and other healthcare providers. Evaluation. There are several existing ways in which to evaluate the efficacy of Cerulean simulations. The first is the student's milestones and seeing if the accuracy of assessment and diagnosis improves. The second is measuring patient outcomes and patient care, and does Cerulean simulations increase patient care? The third would be a student self-assessment of how well prepared or confident the student feels with the assessment and diagnosis of patients. I hope you have enjoyed this presentation, and I'm excited to see and learn what you all came up with for yours. Thank you for a great semester. Have a wonderful day.